If, like me, you are concerned about the health of our children, your grandchildren, then this episode is for you because we've seen a drastic change in the health of children. We see type 2 diabetes being diagnosed at younger and younger ages. When I was younger, I would hear about adult onset diabetes. Well, no, it is being diagnosed in young children. We have an obesity crisis. We have children who are consuming ultra processed foods, and that is a big part of the problem. We have food companies who are literally engineering foods with that right combination of sugar, salt, and fat, not only to hijack our taste buds, but to hijack the taste buds of young children where they are preferring this. So we get into ultra processed foods. We talk about solutions. If you are a health coach or thinking of becoming a health coach, this is an area where you can really make a difference because parents need support. They have busy lives and it's overwhelming they often think, how can I prepare nutritious meals? I want my children to have a healthy diet, but perhaps I can't afford it. I don't have the time. I may be working 2 jobs. I'm a single parent. So there are so many obstacles. These are the things that we get into with my very special guest. She is a good friend of mine. I'm talking about Dr. Medea Saeed. Let me tell you about Dr. Medea Saeed. She's also known as the Holistic Mom MD. She's a practicing board-certified family physician, an international speaker, and a global best-selling author of The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease. She wrote Adam's Healing Adventures, a children's book series, which we're going to talk about today. Dr. Saeed is the Director of Education for Documenting Hope and Know Ye Well. She sits on multiple medical advisory boards, including Holistic Primary Care and Wellness Mama. She was the past president of the International Institute of Islamic Medicine and is the president of the nonprofit organization Pure Healing Foundation. Dr. Saeed and her children speak internationally in the most prestigious medical holistic conferences. They've also appeared on radio and television. Her children host the Holistic Kids Show. This is a podcast that has over 150 interviews, helping kids empower and educate other kids. So without further ado, I bring to you Dr. Medea Saeed. I think you're going to enjoy this conversation as much as I've enjoyed recording it. This is the one and only Dr. Medea. She is not only a colleague of mine, but she is a very close friend. So excited to welcome you to Health Coach Talk.
I am so incredibly honored to be here. This is literally a dream come true. You are my hero. So being here with you is like goosebumps. I'm like on cloud nine. So thank you so much for having me.
Well, you are amazing. You are an author of many books, but today we're going to focus on a special series. So, would you share your newest work? Because we're going to dig into ultra processed food and particularly how we can help our children, our grandchildren, to avoid the dangers of ultra processed food.
Absolutely. Well, the newest edition, this is the 4th book of it's called Adam's Healing Adventure: Fake Food versus Real Food, the Food Label Detective. Oops. And my 13-year-old actually illustrated this book. So it's really exciting. It is the 4th. So this is the first one. Then I have one on like the rainbow foods and then gratitude. I know you have them all. At least I hope so. Otherwise I'll get them too. But like this is the latest one, which is such a huge problem today. Because if we just look at the statistics, year after year, asthma, allergies, eczema is affecting more and more kids. I remember that when my when my 16-year-old was in high school, was in kindergarten, there was only like one table of like, allergy nut-free table. And now it's like two or three and four and like multiple. And then walking into the nurse's office, EpiPens are like now the new normal. So this is a problem. And then we think, oh, this is just it's like the new normal. But if we actually start to look at the statistic, like we know that asthma and allergies are on the rise. 1 in 6 youth at ages 2 to 19 are overweight. 1 in 5 have obesity, and 1 in 16 have severe obesity. The incidence of type 1 and type 2 diabetes is like growing at an accelerated rate, where I think just in the pandemic, the diabetes type 2 in kids has doubled. JAMA reported 1 in 3 teens have pre-diabetes.
Yes.
Diabetes. So, and then not even just pre-diabetes, like the amount of teens that are now dealing with fatty liver is unheard of. It was never like that before. And then that was the body, but what about their brain? Roughly 1 in 5 teens report experiencing depression and anxiety. So 1 in 10 have ADHD. So the risks of all of these chronic health conditions are on a rise. And we did not see these problems when I was growing up. Like, this was not in my day and age. I mean, even if you just look at the autism rates, and it's crazy how they're just exploding. And if anybody's, oh, it's just better diagnosis, but where are all the super severely autistic? There may be some, but they're not, like right now in the kids, like there's 1 in every 32 kids, right? At 34. So it's like craziness how this is just exploding. And I don't know any 42-year-old that has severe autism. And so our kids today are dealing with things that we have never dealt with. And not even just that, our planet is suffering, right? With all of this fertilizer that we're throwing on. Like, I think in 1965, we used only like 46 million metric tons of fertilizer. But now it's like 195 million tons. So these are all chemicals and toxins we're dumping into the land. That's creating marine dead zones. That's decreasing the biodiversity. They say that we're 1/3 of plant and animal species on the planet could face extinction by 2070. So 75% of our pollinator species are disappearing at a rate of mass extinction. And the United Nations says we only have like 60 harvests left of topsoil, because we're all turning it into dirt that really doesn't have those microbes in it. So there is a problem here. We need to wake up.
Yes.
And this is where we need to start asking the questions. Why are we getting sicker? Why are our children getting sicker? Why is our planet getting sicker? And we need to educate our children. So we need to figure out those answers are, educate our children, because guess what? Children, this world we're inhabiting, this is theirs. Like, we've now, like, yes, we have like a couple of 50 years left on the planet maybe, but like but what about our children? We are inheriting this down to them. So we have to start educating them about what is going on and what we can do about it.
Oh, you are so right. And your talk about the rise of autism, for example, I want to share something. So many years ago, we're talking in the 70s, I worked for a local teachers college and I supervised practicum students in special education. And I would go out to the centers where they were doing their student teaching. And one was a facility, it was for kids who were high risk, kids with autism. Now, I want to tell you, and you are also in the Chicago area. Well, this was Lake County, which is just north of Chicago, and it extended from a road that was just north of Chicago up to Wisconsin. That's how big it was. So all of Lake County. So think of this massive county that is north of Chicago. There was one classroom. There were 9 children who were diagnosed with
That's
autism in
wow.
all of Lake County. They had one classroom. So these were kids who were severe. Now, some people, as you said, could say, well, the diagnostics weren't very good. Well, I was one of those psychoeducational diagnosticians doing that testing, and we had state of the art ways of assessing in terms of specialized testing. Parents know that something was wrong, teachers identify. So we were diagnosing those kids. So that was just one example. And you're correct. And when I taught school, we didn't have, there was no special table for allergies. The parents brought in snacks. We never had nut free. And so something has changed. And in my day, we called it adult onset type 2 diabetes. We didn't say type 2, we said it's adult onset diabetes. Now, of course, we're seeing this pediatric endocrinologist. So you make such a good point where we have to reach the children. And that's why I think that this book series, particularly this last one, so how can we help kids recognize fake food and make better choices?
Absolutely. Well, we have to teach children that the reason why our bodies are becoming out of balance and our world is becoming out of balance is because we are not feeding it the foods that it was intended to eat. And we're putting all of this artificial chemicals that we're, using to create these foods into the planet, and we're destroying the planet. So we have to recognize that this body is one of life's greatest miracles. So as we're sitting and talking about 300 million cells die every minute, producing 25 million new cells every second. Every 10 seconds, there's a million new white blood cells, 20 million new red blood cells, 30 million new platelets every 10 seconds. The heart is beating close to 100,000 times a day, or we're breathing about 22,000 times a day. But it all starts with that basic building block, the cell. And we have all the average human body contains about 37.2 trillion human cells. And each cell contains cytoplasm and all of these different pieces like Golgi apparatus, lysosomes, peroxisomes, mitochondria, nucleus, ribosomes, but the most important is that mitochondria. And the mitochondria is a lot more than just the powerhouse of the cell. The mitochondria is constantly sensing and integrating the environment. And so every single mitochondria in your body is always surveying, am I safe or am I unsafe? Am I in, peacetime metabolism and I'm in wartime metabolism? So depending on the state of our body, and we need, so each one of these cells needs real food to function, right? But unfortunately today we are not giving our kids and our bodies that we're just giving them ultra processed foods. And that ultra processed food is raising our blood sugar higher than it's ever raised it before. It is leading to, the glue stickiness, which basically now is attaching to everything and creating problems, or glycation. It also is leading to destroying our gut microbiome. It is destroying our gut health and then thereby destroying our brain health. But most importantly, it is destroying these mitochondria and leading to something called chronic inflammation. So if we live unbalanced lives, so for example, if we're giving our kids too much junk food with chemicals and we're not eating enough of the good food, toxins, all these things, it's actually starting to, these cells don't work and they don't do their job well. They start to go off balance. And when they start to go off balance, it creates this flame, and this flame gets bigger and bigger, leading to chronic inflammation, and can really create all of these chronic health conditions that we are dealing with. Now, some people are like, oh, is it inflammation that causes mitochondrial dysfunction, or is it mitochondrial dysfunction that causes inflammation? But nobody exactly knows, but what it is fundamentally is your immune system is not working properly, and specifically because of these ultra processed foods is one of the key pieces that is really disturbing our bodies. And this is where I really want to emphasize here. because food is not just food. You know, if we're like if we're in a car, right? In order to give make sure the car works, we have to give it the right fuel.
Mm.
And this is how I teach my kids. Like if we give cars, oh, but today apple juice is or orange juice is cheaper than gasoline is. And so let's go ahead and put that in the car. Do you think it'll
Yes.
work? And they're like, no. So that's really how I start to educate my children about teaching them that our like what's going on in the cell, what's going on in the mitochondria, why these ultra processed foods are so bad for us, that we need that food is not just food. We need food to run trillions and trillions of biological processes that are occurring in your body every second. And if we put all these unrecognizable ingredients in it, like junk food, our bodies are going to work like junk. And we know that real food is what our body needs to not only optimize our immune system, where 80% of the immune system lies in the gut, but also it determines the health of these trillions of gut bacteria and the biodiversity that then determines your health. And this fake food, this ultra processed food, and I tell them we go we look at the ingredients. We say, you know what, is this food even food? Like go and look at like red number 40, yellow number 5. Like what are these things? So ultra processed foods, they use these industrial methods and these ingredients that you can't even find in a grocery store, like hydrogenated oils and additives and high fructose corn syrup, emulsifiers. They all lack value. And unfortunately, today, more than 70% of all of kids' diets comes from ultra processed foods. So how are we expecting our kids' bodies to
Yes.
work when we're giving, and then studies have shown that there was a large study that came out in 2024, so this year, that consuming ultra processed food was associated with at least 32 health problems like heart disease, diabetes type 2, and then mental health disorders. This again leads to those blood sugar spikes that lead to glycation, the sugar cells sticking to things like protein, fat, and DNA, leading to chronic inflammation, oxidative stress that hurts the brain. So unfortunately, this is so I teach the kids. I know you're like, oh, but this is too difficult to teach the kids that information. They're learning really complex things in school that we're not even going to really use. I mean, how many of us are actually using like division on a daily basis, right? But the thing
Yes.
is, we need to actually help them look at the ingredients, figure out what these ingredients are and how it's actually affecting our body. That these ultra processed foods are not that they're not like not doing anything to us. They're actually hurting us. They're throwing our cells out of balance, leading to chronic inflammation, oxidative stress that can break down the whole car. And that is what I really start to emphasize, to show kids that there's these friends in our gut, this the mitochondria, this is what happens. And going through this in a large amount of detail with the kids, and then again helping them become food label detectives to understand what is going on in their food.
It is critical that we impart this information to our kids. And there's a time in their life when parents have a lot of control. And so many times, though, kids, when given a choice, they'll choose the ultra processed option and it hijacks their brain. And then now they're addicted to it. And then it's so hard for them to make better choices because it just doesn't taste the same. And one of the things that I see as going through even places that are healthy, like a Trader Joe's or or a Whole Foods market, and you see health washing, especially with kids' cereals. I was noticing this. Well, it's eco-friendly, it's gluten-free, it's keto. They're so adept at the front of the package at having the latest buzzwords, and yet it's meaningless. You got to look at the back. You got to look at what is in these foods. And yes, it may not have the red dyes, but it still is giving them empty calories. It may be full of seed oils, and it's not real real food. But what do you say to a parent who's saying they're busy? Now you're very, very busy and you've got 5 kids and you manage to cook. I'm just amazed at what you get done in a week. But for someone who say I'm overwhelmed and I can't cook from scratch and or I'm on a budget, I can't afford organic, for example. How would you help a parent who is concerned and yet they have a lot of reasons why they cannot give their kids a healthier diet?
Absolutely. And it all starts with empathizing, right, with them, because the fact that
Mm.
it is difficult, especially in this day and age when we are bombarded with easier, meals that are just to go. Parents are working full-time jobs and then their kids have school and then it becomes a lot. And so I completely understand and I have been there too. But specifically when we show that there are so many healthier alternatives to these fast food options, and to recognize that that's first to give them hope and like there's so much hope that we can do. Like there's so many natural, like if your kids like want chips or like there's places that you can quickly get a salad, there's places it is possible to look for those real food options. We just got to look. And but the thing is, I think the biggest piece comes from educating the parent. And we need to recognize that if we as parents don't take control of the situation, big food, big tobacco companies are going to take control of your child. And I know this is really sad to say, and now you're going to
Mhm.
probably like, okay, now this is a little cuckoo. Like, no, because it's studies
Mhm.
have shown that that fatty, salty, sweet food that make up like 68% of the American food supply has been pushed onto us by these nations leading big food corporations. And for decades, the tobacco industry hooked people on cigarettes by making their products irresistibly addictive. And then recent studies have actually shown that these tobacco companies have the same strategies, are using the same strategies in big food that works for them, getting kids and adults hooked to tobacco. And so in like the 1980s, tobacco kings like R.J. Reynolds and Philip Morris acquired companies like General Foods and then and then we have Nabisco Kraft, and they developed this highly like number of hyper palatable foods between 1988 to 2001. And so that then resulted in a substantial tobacco related influence on our United States food system. So we think that our kids are like, oh, do they just want it? It's easier just to give them this food. No, we need to first take a step back and recognize, yes, they're craving those foods, but why are they craving those foods? They're craving those foods because of the fact that they have been manipulated, right, by these big food companies to create that artificially rewarding eating experiencing by how by filling with sugar, caffeine, fat, sodium, bad carbs, like all this stuff. And actually we're being tricked and addicted. And we know that, like, for example, now even on TikTok and stuff, influencers or TikTok and social media influencers are being paid by big food to promote their sugar and artificial food. Commercials now, a lot of the commercials, like over like almost half of the commercials out there are for processed food, ultra processed food companies. So to recognize that if we as parents don't take charge, somebody else will take control of our children. If we don't help them make their own choices, if we don't put them in the driver's seat of their own health, if we don't educate them, because guess what? They're not going to learn this in school. They're not going to learn this at their doctor's office. As a family physician, we were never taught any nutrition unless I missed it during maternity leave. But the thing is, like, you're not going to learn this on social media. So, this is where us as parents need to take control. And for that busy parent, I understand it is frustrating, but there's so much that we can do. And we've actually talked about this in the book, and this is where, as a family physician, I knew nothing about this before. I had to educate myself
Mhm.
and learn about this and then find out what are these ingredients, and then I would go to the store with my children and look at those ingredients, like, oh, what is red number 40? Let's become food label detectives. Let's go home and let's research. I was researching it for myself, right? But we
Yeah.
were doing it as a family. Go look at it. I'm going to find those. What do these things do? What kind of harms do they have on the body? Are there any pluses, mine, like what's going on? And so having your child take full control of that and getting them all involved is key, right? Because otherwise you're like, it's like you're fighting, right? And then any busy parent is like, I'm just going to give up and just give the kid what they want to shut them up because I got better. I have to get on with the next thing. I'm overwhelmed myself. And this is why prioritizing your meals on real food. So I think we gotta, empathize it, role model it, start to educate yourself, and then prioritize and eating
Yes.
real food. Just start there.
Mhm.
If we
Yes.
just incorporate more real food, we can crowd out all the bad. So for
It's
example, if your
yes.
kids absolutely love and I love to start wherever the child is at. So for example, they love pancakes for breakfast. I'm like, good, then let's make them pancakes for breakfast, right? I use like a cassava flour and then I put Himalayan tartary buckwheat in there
Mm,
and then make
I
that
do
into
too.
pancakes.
Yes.
Right? It's so delicious.
Yeah.
And the kids will have that. And if they can then they can put whatever toppings they want it, like blueberries and, different types of raspberries, blackberries, and make a little face out of it, whatever it is. Just they can have anything they wish that they would want, but then you just have to find a healthier alternative. So, for example, if you're on the run and you want something cheap and easy, I'm just thinking like most places have like a Chipotle, which is non-GMO, right? But even a healthier and better option, Whole Foods has like a whole chicken that is
Yes.
like $11 cooked, organic, and it's like 11.99 or whatever for the whole cooked chicken that can feed an entire family. And then I grab a packet of coleslaw. I put I put some avocado mayo in there and honey and a little bit of honey and just to sweeten it up and a little bit of Dijon mustard. And now
Yes.
you have a meal for the entire family in seconds,
Yes.
right? And those are things that you can do even out and about. And this is what I do whenever I'm out and about. I'm like, oh my God, I have 5 boys to feed. Where am I even going to find any food right now that's cost effective, fast? So if I'm in a rush, this is what I'll do. Or I'll even have like salmon, right? If I like, I'll take salmon out. It takes literally minutes to cook salmon, or I'll have smoked salmon and take that with me everywhere we go. So there are options. There's beef jerky sticks, right? That are clean
Yes.
with no
Love
nitrates and
them.
yeah, exactly, right?
Yeah.
There's bars out there. You can even, so whatever it is, vegetables, clean protein, healthy fats, fruit, eating the rainbow, so many different options. If we start counting, like, oh my God, how many different options? Like the options are endless and so much fun. So even if you're on the go and busy, it can be done, but making it simple and easy and cost effective is doable.
I love it. And what I'm hearing is making it fun, relax about it, because we do not want to go to the other extreme, because we know parents who become obsessed and will pull their child out of a birthday party when everybody's having the cupcake. And well, you can't have it. And then the child throws a fit. So knowing that there is room occasionally, but once their palate has not been hijacked, they're able to have those occasionally and then go back to the way the family is eating. And as a grandparent, when you mentioned Himalayan tartary buckwheat, I have a recipe for, like, we call them toddler muffins, because my toddler twin grandkids, they love it. And it's just buckwheat flour and mash up ripe bananas. So, and, very little sweetener. And there are these mini muffins, and they love them. And it takes minutes to make them in
And you
big
can take it on the
batches.
go,
And
right?
you
You
take
can
it on
probably
the
take them
go.
on the go. Like
Yeah,
that's like high
exactly.
power food for like, let's say you're a sports mom and you're going here, there, and everywhere.
Yeah.
You take these little muffins and that's like quick, quick energy, nutritious energy.
Yes, you could throw in protein powder. So health coaches, I believe, can be critical because
Yes.
they're going into schools, they're having special programs, they're working with PTAs, helping schools that are establishing gardens, but also supporting parents because, as we're saying, it is tough and to go against the mainstream of these big companies that are seeing profit in our children and our grandchildren getting sick, because big pharma would like nothing better than to have a child getting sick, because that means for the rest of that individual's life they're going to be dependent on medication. So it's cost purposes, we need to take charge, and a health coach can help parents feel empowered that you can help, that you can make a big difference in your children's life, and even working with grandparents, because often there's family dynamics that get in the way. So that's something that, in terms of the psychology of eating and how families can often get torn apart because maybe one spouse believes in eating one way and thinks so the parent's crazy for this, or a grandparent sabotages or sees of what families are doing wrong, wants to intervene. So many issues, and a health coach can really help to support people wherever they're at in this journey.
Absolutely. They are the most critical piece of that puzzle because remember, doctors are not taught this. And this is where health coaches need to step up. You have an intimate relationship with that family and with the children of the family, and really start to create a plan and help your families create this plan that can be lifelong, not just like a quick diet,
Yeah.
right?
Yeah.
And this is where helping them, hold their hand, walk alongside them, show them this is doable. It's so much easy. It's fun. We can, don't get overly stressed. It's okay. The body is resilient, right?
Yes.
But the thing is providing them with that tools. And sometimes all the patients and the families really need is somebody there to hold their hand.
Yes.
Because it is a scary world out there, especially when you're eating against the social norm
Yes.
and where you're looked at weird and you have to now change your entire eating way and lifestyle. It is a lot. And that is where health coaches are key in making that transition easy and lowering the stress for
Yes.
those families. And so we can really create that change. So you guys, health coaches are that drop in the ocean that can create that ripple effect because you touch so many people's lives. And it starts with all the guidance that you can give them. And this is why it is so important to start educating yourself and then obviously then your families. So then we can truly make the world a better place and educate our families to take charge of their own health.
Well, Medea, you are making the world a better place. So, can you hold up this new book one more time? This is wonderful. I can't wait to share this with my grandkids. This is a wonderful book. It is never too young to have kids looking at identifying real food versus fake food. So,
Absolutely. And then
Medea,
in the back here, I do have, we talked about how Adam is becoming food label detectives and then even
mm,
finding healthier alternatives for the foods that he eats, like eating the rainbow.
oh,
And then at the end, providing them with a list of fake food versus real food options, you know?
ah,
So then they have that. They can take that to the grocery store with them and say, you know what? Like, let's say I love like juices. What can I do instead of that? I love soda. What can I do instead of that? I love McDonald's. I love like Doritos, Takis, things like that. So then I've gone through a lot of the main foods that our kids
yeah.
are really like, but then finding that healthier alternative. And it is doable. It's so much fun. My kids actually just love to go to the store, go with me and taste and find all those different things, read the
Mm,
ingredients. It is so much fun. So if you guys,
oh.
if we can do it in our house, you guys can. I know Sandy does this too at her house with even with now hopefully and with her grandbabies now. So we can do this. Thank you so much, Sandy,
We
for having
sure
me on.
can. So, Medea, where can people find you? Where can they find the book?
I'm on social media, Holistic Mom MD. My social media, we also have a podcast. called the Holistic Kid Show podcast, where the kids have interviewed over 155 people. And then all my books are on Amazon. So I just submitted my 9th book to the publisher. So this is number 8.
Yeah, we'll have to have you come back and talk about that, and check out this podcast that her kids run. It is phenomenal. And they also spoke at an IFM's International Conference. They were rock stars. So this is so wonderful to be with you. Thank you so much for being on Health Coach Talk.